So health anxiety is a misunderstood concept, and it is quite heavily stigmatized. People have often not heard of it, or if they have heard of it, it's not always seen in a pleasant construct. So sometimes people have called people with health anxiety the worried well. This is a mistaken term. As well as being anxious, follow-up studies that have been carried out over 10 years have shown that people with health anxiety have higher rates of heart attacks, have higher rates of strokes. Health anxiety disorder is at least 1 in 100 people. It's probably nearer to 3 in 100 people when people look at the whole lifetime. There are basically two forms of health anxiety. Health anxiety which has the consequence of wanting people to seek reassurance from doctors or find out more information from the internet, and this can sometimes get to the extent that it becomes dominating in their life and they're unable to do other things. The other form is that people become so anxious about their health that they actually don't go to the doctor at all and avoid thinking about it, any kind of health connection at all, and they can sometimes be afraid of going to health and then delay. It's also possible to have both, be too anxious about your health and go and seek help excessively for some problems, but at the same time not report and ignore something really serious. Treatment for health anxiety disorder is available. However, only a small proportion of people with health anxiety have so far gone to get such help. It seems that the treatment as it's currently offered is not in the format that people with health anxiety disorder would like, and therefore we have been researching ways of making this more acceptable and more available to people with health anxiety disorder.